Hey, I'm Kristen Hardy, nurse practitioner student at Auburn University. I'm going to demonstrate a laceration closure with simple interrupted suturing. So the first thing you want to do when you have a laceration is go in and assess it. Make sure that it is something, first of all, that's safe to be sutured, that does not need surgical consult. You want to make sure that if there's foreign bodies, you may need to perform an x-ray, so consider that. And also the wound needs to be thoroughly irrigated to remove any foreign particles, and kind of a pre-cleanse area with like normal saline. You're going to explain your procedure to your patient. Suturing is a sterile procedure, so you'll set that up. You'll cleanse the wound with the product that comes in your suturing or your laceration kit. And you're going to choose your suture based on the size of the wound and where the wound is. Since we're going to pretend this is a wound just on the leg, on the upper thigh, and it's a very small wound, so we're going to use the smallest needle possible. Basically, the idea is you want to have enough strength in your suture to hold the laceration together. So that is how you choose your sutures. And like I said, this one's a small one. You're going to perform local anesthesia with lidocaine. Since it's on the leg, we're going to do, and I'm going to say it's not bleeding too bad, so we're going to do plain lidocaine. Lidocaine with epinephrine is a choice, but you don't want to do that on the fingers, nose, toes, or genitalia. So first thing you're going to do, we've cleaned the wound, I think I said that, is go ahead and pick up your suture about 2/3 or the way down. Okay. Meanwhile, you're going to ask your patient, make sure they're up to date on their tetanus shots. So kind of look at your wound, look how deep it is to determine how deep you want to put your first suture, or all of your sutures rather. And you're going to go in at a 90-degree angle. And for the interrupted, you're going to come through the skin right above the wound. And pull it through. You're then going to take your grasp your suture again about 2/3 of the way to the bottom. I have a really hard time with this with teeth. I'm going to use these Kelly clamps. I know some of the kits have pickups without teeth, but it's going to take me way longer than 15 minutes to do that. So let me get this thing grasped right. Almost got it. There we go. Not quite. Okay. All right, and then you're going to go on the opposing side and bring it up. And pull it on through. You're going to leave maybe 2 to 3 inches on the back side. You're placing your needle on your sterile field. You're going to use your needle driver, and you're going to do 2 throws towards the wound. You're going to grasp that suture towards the end and then pull it through. And then you're going to do 1 throw away from the wound, grasp and pull. And depending on the size of your wound and how much enforcement you need, you can do additional throws to strengthen your suture. Okay, you're going to cut your sutures. Okay. And again, I cannot use those pickups with teeth. My hands are really shaky and it's hard for me to grasp my suture. So, all right, got my suture loaded again. And I did start in the middle So we're going to do the same thing, going at about a 90-degree angle, come through. Use this to pull the skin back a little bit. Try that again. Okay, just pulling through and repeating the same process, leaving you enough suture to grasp and pull through. So 2 throws towards your wound, pull through, make sure you're bringing your knot on the side, not above the suture line or the laceration. Gonna go opposite direction, pull it. Pretty small wound, so I think that's enough. So we talked about cleaning the wound beforehand, and it's going to be important to educate your patient on wound care at home and how to care for the sutures. Let's see. So you're going to tell your patient to, this type of suture, just keep dry for the first 48 hours or so. And then they are able to wash it with, you can use antibacterial soap or just a mild soap. And you can put some Neosporin on it to kind of keep it, minimize any bacteria growth. You do also need to consider antibiotics when the patient comes in. Up to date says that if the patient is healthy, it is a minor wound, antibiotics are not indicated. Another piece of discharge or information you want to give your patient is to monitor for signs and symptoms of infection. And so you would just advise them to keep an eye on it, do the proper cleaning procedures. If they start to notice any redness, swelling, drainage, pus, anything like that, they would definitely need to come back in for reevaluation. I'll actually undo that one because it didn't give me a strong enough knot. So 2 passes, and I'm gonna pull it through. That's better. Okay. Now we're gonna go away from the wound, pull it through again. And cut your sutures. Okay. Just pull it through here. You want to try to get all of these even. You don't want to pull your laceration too tight. It can cause some scarring if it's pulled too tight, but you do want your edges well approximated. It's really hard on the end here to get this. So it looks fairly even. In the real world, I might have adjusted that to bring a little more closure right there. Or you could throw in another suture there just to add a little more approximation. But they're pretty approximated, and it's a small wound, so I think it should heal fine. But depending on where your sutures are and what type of sutures you use is the basis on when the patient comes back to have the sutures taken out. This type of suture, most sutures for lacerations, you would have the patient come back in 7 to 10 days for removal, or sooner if they encounter any complications. Thank you.